I discussed genomic patterns in smoldering multiple myeloma. This is a very critical area right now because there's a lot of research being done to see how we can prevent patients with smoldering myeloma from progressing to myeloma. Can we prevent the cancer from developing? And to do that, understanding the genomics is critically important. So currently we are beginning to have a lot of data in this area. One of the most significant early findings we have that was very recently published shows that there are certain copy number changes which start very early, not even smoldering, but they start in MGUS. Traditionally, we thought this is connected with myeloma, but now we know it's connected with early stage of the disease. For example, trisomies of chromosome 15, 19, and 9 happen very early. We also realized that 1q amplification could be early. 13 deletion could be early, and that these changes observed in myeloma are all observed in smoldering. So there is almost a pattern where there is a very little difference between what we observed in smoldering versus what we observe in myeloma. So I think that's an important first step. And then the second part of the discussion was on what really causes a progression of smoldering myeloma to myeloma. And we have done a whole genome sequencing, deep sequencing, to understand the mutational pattern, and we have identified there are two types of smoldering disease. One smoldering is where we observe the changes, mutations, that when it converts to myeloma are not changing, suggesting that conversion of those smoldering patient to myeloma does not require any new acquisition of mutational change. What it means practically from treatment point of view is that those are the patients who we call smoldering are really genomically myeloma, and we should start treating them like that. On the other hand, half of the patients were those who required some new mutations to come up, took longer time to that to happen. Eventually those new changes lead to development of myeloma. This group has another significance, and that being that those are not myeloma yet, that they, if we apply proper methods and proper treatments, can be prevented from developing myeloma. So they do not need to be treated in myeloma, they need to be prevented. And so we could have preventative strategy. And I think now doing larger study with this theme of two types of patterns is critically important to understand which patients should be considered myeloma versus which should be treated as an early disease. Maybe we should call them MGUS. And then we have also begun to understand what causes this mutation, which causes progression. And we have identified patterns and the methods. So there is a mutational signature called AID that causes early change, that causes MGUS. There's another mutational process called APOBEC that seems to cause the later change, cause probably progression to myeloma. So now we can understand these mutational signatures, we can develop specific treatments to inhibit them to prevent those kind of progressive pathways that the disease follows. So I think this is the general current landscape in smoldering myeloma.